Bob is going to be staying back for our second interview. I'd now like to call on another leader in the fight against opioid abuse, Congressman Paul Tonko. Congressman Tonko is a member of the House Energy and Commerce Committee and is a Democratic vice co-chair of the Congressional Addiction Treatment and Recovery Caucus. He has just introduced legislation in the House to expand access to opioid addiction treatment, particularly to vulnerable populations. Welcome, Congressman. Over to you, Bob.
Thanks, Johanna. Thanks, Congressman, for joining us this morning.
My pleasure, Bob.
I always want to start these type of things and these events with not acronyms, but stories from your districts of how it's affecting people and to really bring home how serious this problem is.
Sure, absolutely. My hometown of Amsterdam, New York, population of about 18,000. So you can fit that population into the Times Union Center in Albany that I represent. A great town, loving families, great work ethic, has experienced, I'll use an example of last December, 4 deaths from fentanyl and a dozen near misses. So for a small town like that, it rocks the population. I've had a neighbor who lost his battle with the disease, a dad of 36 years old, of 36 years of age, and 3 children. Just powerful impacts that remind us that there is a crisis out there, a crisis beyond many that we've faced. It equals just about the fatalities from gun and deaths from traffic accidents, and surpasses the AIDS and HIV crisis of the 90s. So that should speak to us in measures of urgency and the need to go forward with fact-based, thoughtful, data-driven solutions that will respond effectively and reach our senses in a way that enable us to move forward with progressive policies and a commitment in the federal budget to the cause of fighting addiction as a disease.
What are the lessons learned over the last several years moving forward, and do you think that this epidemic is getting worse or getting better?
Well, no, there are signs it's getting worse. The Center for Disease Control and its data for 2016 indicated about 64,000 deaths related
some of the projections
to
going
addiction.
forward are
Exactly.
Yeah.
And that showed, I believe, around a 21% increase over the year 2015. And again, just knee-jerk reaction by any of us in elected roles in Congress will recognize that in our communities we're seeing this more and more, and many, many families asking for help. And it doesn't know for any strata or boundaries. It impacts all of us. Regrettably, I think there was an earlier curve that we needed to address when it was inner city, but now that it's expanded into all populations, let's move forward and get it done once and for all. And to deal with it, not with half measures that make us feel good or outdated, unsubstantiated stereotypes or stigma. That doesn't serve anybody well. We need to go forward and see this as a disease, address it as a crisis, and make certain that we use all of our tools in the kit. I would encourage, based on the commission, the opioid commission established by the president, that he listen to the advice of that commission, which asked for him to go forward and sign the measure for an emergency situation out there, a national crisis. That will get us funding, that will open up some of the opportunities that have not been reached to, and will enable us to respond to this as a nation with a heart pounding away at this crisis.
Initially, it took some time for the president to label it a national emergency, and HHS initially said it wasn't, and now the president has deemed it that. But we've written about this that since August, and the president has been busy with hurricanes, but that there has been a lack of follow-up and procedural steps that need to get done.
Absolutely. You know, I think there are things like addressing the IMD restrictions, the institutions for mental disease, allowing for those centers that have 16 beds or more to receive Medicaid funding. You know, we've done some work there where with managed care, we relax the restrictions somewhat, or where states can come up with a comprehensive plan, there may be a waiver granted. But I think across the board, we need to do something with the IMDs in a way that enables, again, us to have that service delivery that is so essential. But when you talk about things that we've done in the past that may have restricted us, I'll cite the most recent past, the last 7 months. This could have been the greatest blow to fighting addiction ever, when we saw some of these iterations of repeal, replace, delay the Affordable Health Care Act. They were a brutal response to those who struggle with the disease of addiction. The Medicaid expansion effort would have been denying many, many people their access to services. It would have crushed families out there. And also, the repeal of various provisions, like the Essential Health Benefits Package, that would have been denied, would have then restricted response to addiction and mental health services. So that would have been awful. And the pre-existing condition clause. Getting rid of that would have meant that if someone is in the midst of fighting their addiction, their disease of addiction, they would have been denied the insurance. So a cruel and brutal blow that would have been dealt this community, the addiction community. And luckily, we warded that off. And I think we did the right thing.
What is the role of Congress going forward in legislative solutions? You've talked about some laws that have been passed, and Senator was talking about, you're a member of the Energy and Commerce Committee. What is the panel doing? What should be done? And the role of Washington in oversight?
Well, you know, we did a major step last year with the Comprehensive Addiction and Recovery Act. That enabled us to expand services. We lifted a cap on those who can administer buprenorphine from 100 to 275. That's a restriction that was imposed onto the medical community. We then added physician's assistants and nurse practitioners in a way that added more disciplines that could be living within that cap, so that services were made much more readily available for individuals. There's a sunset on those disciplines, and there's you know, the need to make certain we safeguard the 275 threshold. That responded in a very powerful way, because as I visit those individuals who are struggling with this disease, they tell me they can wait as much as a year. This came personal anecdote for me in my district, waiting a year to get services. Now, when that moment of clarity comes, when you've determined you need to go sober, when that moment of clarity comes, that is the time to have the services. And you need those services to meet the individual where he or she is. And so it has to be tailored to the individual. This enables us to do that, I think, by expanding the comprehensive, by implementing the Comprehensive Addiction and Recovery Act. We're going to make a major step forward. Now, our efforts now should be to fund that fully in the budget, making certain that CARA is funded fully, and that we also respond to the $500 million state opioid abuse grant effort as guaranteed in the 21st Century Cures Act, making certain that's funded also. But these are measures of the instant that we need to do. I've introduced legislation, Bob, that further expands upon CARA, and it's the Addiction Treatment Access Improvement Act, which would first codify the 275 number, the threshold, which is important. Codifying it is very important. And then we remove the sunset on nurse practitioners and physician's assistants so that we won't have a slippery slope there. And then we further add the various nurse professional standards or disciplines like midwife nurses, like nurse anesthetists that can add to the service delivery. We further stretch that, which is a great benefit for pregnant women and postpartum women who will be benefited by that expansion. It also guarantees that the MAT, the medication-assisted treatment effort by non-physicians be maintained. So I think it's a major step forward. It's a bill that I would hope will get passed in this session. I've introduced it with Representative Lujan, Ben Ray Lujan, in the House, and we're very hopeful that common sense will prevail and that compassion will speak to us in a way that enables us to go forward factually with the work that needs to be done. I think, you know, those measures are important, and also dealing with the Medicaid reentry bill that I'm working on that would allow for states to start as early as 30 days before release for those who are incarcerated to begin that Medicaid coverage. The worst thing we can do is send out those who have been incarcerated without the correct tethering to a system. They're about 8 times more at risk when they leave an incarceration situation and they go back into that environment that has perhaps led them down that very difficult trail.
There have been some people who've said, when you look back to the crack epidemic, that that was dealt in very much in a criminal type of way, in enforcement. How do you toe that line? And opioids said, well, it's been viewed more as a public health crisis, which of course it is. But how do you toe that line? What are the lessons learned from those days of what works and what doesn't?
Well, first, it's been very expensive to go through this effort to arrest and incarcerate. Granted, there has to be a mix of response here, but we're not going to solve this, Bob, by arrests and incarcerations. The stats show us that that's just not happening. And I think we have to put greater emphasis on prevention and on services and on research, making certain that we invest in research. I understand that the senator shared that the Senate approved a $400 million effort in their House. I think it's important for us to enhance to the greatest level that we can. Their number is better than the House number, but I hope that as we come together here, we will have a super commitment to research. The brain is the least researched organ of the body. And this would respond not only to an addiction situation, the disease of addiction, but also neurologically based diseases, Alzheimer's, and various dementia that need to be addressed. This could unlock untold opportunity if we invest heavily in research. And again, the brain has been really stepchilded in this effort to invest in research. So we need to do that. But back to the effort that we should take, I think research can take us a long way to better understand how to address the various lobes of the brain and improve treatment or find cures. But also, I think it's the preventative piece. You know, I've been a very strong advocate, a champion for prevention. I led the House with a letter campaign for robust funding for the substance use prevention and treatment grant program, block grant program. It's important for us to make certain that we invest in that program. The president suggested cutting it, which would be a terrible thing to do in this moment of time. And we're going to go forward. There's a recommendation to provide $1.86 billion for that grant program. That's flatlined from the year 2017. So no harm done. But again, if you look at an inflationary impact placed on those numbers, we're probably losing about 29% of the purchasing power that we need with that comes with those block grants. And I will remind all of my colleagues that those block grant dollars sometimes are 100% of the funding in some given states in our country. There's no match that's required and there's no match that's made. So that is the entire effort for prevention. We cannot go backward. We should, again, increase those numbers and certainly reject the president's suggestion that, that we cut it, as he has suggested we do with the drug-free community programs. Now, I have worked very hard with my local groups. I'm impressed by the work that Margie does in Niskayuna with the Community Action Program, that Davia does with the Troy program, with their drug-free community coalition. These are great responses. I've seen them. They're tailor-made to the given neighborhoods that they serve. And that order of flexibility is very important. And the numbers, again, show that the reduction in the dependency on illicit drugs and on alcohol has been reduced tremendously. So these are the efforts we need to make. You know, this is a crisis, as we stated in the very beginning. A crisis deserves a professional response, a compassionate response, and one driven by the passion that crises would automatically draw from this country. Now, we have the intellect. Let's put it to work in research, and we have the need. We hear it routinely. We see it in the papers every day. We'll see, just looking at an obituary column can tell me what's happening out there. So let's get real. Let's not do half measures, and let's forget the stigma and the stereotypes. We need to go forward in a very thoughtful, meaningful way.
What do you think is the best role? There have been lawsuits against drug makers. The role of providers and pharmaceutical companies in dealing with this, and what can healthcare groups do in Washington to help?
Well, I think we have to be much more sensitive about how opiates are prescribed. There seemed to be, and I'm not going to point a finger of blame, I think there was an unknown factor there as to what the impact could be, the negative impacts, but there needs to be very strong programs, strategic efforts made to address pain management and make certain that there is physician awareness, perhaps education as to the dangerous element of opiates. And again, we need to make certain that we're responding to border controls, because some of these imported efforts of items like fentanyl, which is 50 times stronger as a synthetic opiate, they need to be controlled and make certain that they're not entering our borders. I think that all these efforts, all the above strategy, all hands on deck as the approach, is what we require right now.
We're going to open it up for questions for the congressman, so if you can identify yourself and ask your question.
Hi, my name is Lisa Lutz. I'm from Fairfax, Virginia. I'm back here.
Okay.
Back here in the back.
Okay, Lisa, I couldn't see you.
No
I can
problem.
hear you, but
Yeah.
I can't see you.
My husband and I lost our 21-year-old daughter last year to a heroin overdose. I very much appreciate your efforts, and I appreciate the fact that you clearly have an understanding of all of the facets of this issue. The one thing that I wanted to hone in on was Chrissy lost her life because the heroin was laced with carfentanil. And you mentioned fentanyl, which is 50 times more powerful than heroin, but carfentanil is 10,000 times more powerful. We didn't know for 8 months after she died that that's what caused her death, because Virginia was not routinely testing for carfentanil. I guess my question to you is, are you aware of any national efforts that are going on to ensure that states are looking at fentanyl, carfentanil, that kind of thing? Sorry, I'm nervous. And also that they are taking protocols to make the public aware of the potential dangers of just coming into contact with drugs like carfentanil.
Right. Well, first, my condolences on the loss of your daughter, Lisa. It's that force that drives us with the sense of urgency, and we don't want to see any more families going through what you and your husband did. I think in terms of our public education, public information campaigns, we need to remind people that beware of what you're consuming, because it may not be what you think it is. It could be laced with dangerous elements. In terms of additional efforts being made, I'm not certain what states are doing, but certainly it's a good challenge to us to find out if there's a way to move to strengthen the response of government to that given phenomenon. It's, when you hear of some of these other additives that have such powerful impact and are so much more dangerous, you want to make certain that somehow you can have the oversight to be able to make a difference. But you've offered a good challenge, and we'll take it up.
Question back there.
Thank you, Congressman, for being here this morning. I'm very interested to hear what you have to say. My name is Mark Atwood, and I'm with the Chris Atwood Foundation, named in memory of my son, Christopher, who died at the age of 21 of a heroin overdose 4 years ago. And our real thrust right now, our greatest concern, is trying to get naloxone, Narcan, into the hands of as many people as possible. Not just the first responders, of course, but people, the families, the addicts themselves, institutions on the local level, jails even. It's amazing how difficult it is to actually get this. And my question to you really is, do you see a federal role in facilitating getting Narcan out there to a much greater number of people? And have you heard any conversation on the Hill about how this might be done?
Well, thank you, Mark, and again, my condolences on your loss of your son, Chris. Yeah, I think the declaration of an emergency brings with it, by the President, brings with it the opportunity to provide naloxone to a much greater degree. And I think that our efforts there should be to make certain that the availability is as great as it can be. It's a life-saving measure in many cases, and so you want that opportunity to be there. The whole effort to turn around the impact of opiates in that critical moment is important. And I would also say that the medication-assisted treatment effort is one that we have to make certain we keep with its order of flexibility, whether it's methadone or whether it's buprenorphine or Vivitrol. We want to make certain that the flexibility is there so that we're providing the wraparound programs and the medication assistance in a way that responds most fully to their need. But in those cases of emergency, the naloxone availability should be enhanced.
Time for one more question.
Good. Under the wire. Thank you, Congressman. I want to thank you also, especially because it took about 45 minutes before you mentioned the P word, being prevention.
Okay.
We know, I'm not sure what you were thinking there, but
Well, I was trying to respond to Bob's question.
No,
so-
it was a good
fault.
response. So I just a couple of points. We're really, although we have an acute problem right now, and by the way, I'll back up. I'm Howard Fishbein. I'm an epidemiologist. I work with a research group called Westat Corporation. I've spent about 12 years at health departments running programs, a little bit at NIH for about 3 years, and now I've been doing research. My observation is, although we have an acute problem right now with the situation, this is a chronic condition. And as we know from chronic conditions, the only way you really handle a chronic condition successfully in terms of return on investment, in terms of health outcomes, is with a comprehensive program, which you mentioned, which has a strong preventive side. So far, we've heard a lot about the treatment aspect, and I'm absolutely certain we need all of that, but we've got to look upstream. We can't be working and dedicating all the money downstream. We've got to have some upstream focus for the reality of being able to curb the epidemic. So if you could just comment on that, or maybe just take that away as a message for the future,
Sure.
because I think that's so critical with all the chronic conditions that I've worked on in my career.
Well, I agree. The prevention piece has to be there for those who are living with a chronic ailment. I do think that we need to enhance those prevention elements because arresting and incarcerating hasn't really done the job that we want. I'm not saying it's been a total failure. We've had good things happen, but basically we're not going to be able to go forward much longer without a stronger emphasis on prevention. And again, those substance use, prevention and treatment block grants that go to the states are critical. And our effort now is to make certain they don't get cut And I think they need to be enhanced because, as I said, some states rely on that as their total program for prevention. And I think the community-free drug program money does allow for that local input where they know best how to reach people that they're serving, to reach them at a level where they're at. And this is a very complicated response that's required, but we need to give the professionals and the families out there the tools they need, because it's impacting far too many people. And one death is more than we should tolerate, but the numbers as were cited, a growth in 21% to a level of 21% from 15 to 16 is very instructive, and we should take heed.
We are out of time. Please thank the Congressman for joining us this morning.
Thank you. Thank you, Bob.
Hey.